Good morning, students. Today's lecture is on health information and surveillance system. These are the learning outcomes. At the end of this session, students should be able to define public health surveillance, describe the types of surveillance, explain the surveillance system in Malaysia, and explain types and importance of health information management system. Public health surveillance is systematic, ongoing collection, analysis, interpretation, and a dissemination of health outcome data for health action. Health action can be further investigation, can be preventive activities, or control activities. So, systematic, ongoing collection, analysis, interpretation, and a dissemination of health outcome data for doing health action. Surveillance systems can be classified as passive or active surveillance. Passive surveillance means local and state health departments rely on healthcare providers or laboratories to report cases of disease. So, local and state health departments rely fully on the report from healthcare providers or laboratories. It is having an advantage because it's simple and requires relatively few resources. But a major disadvantage is there. Disadvantage is possibility of incomplete data due to under-reporting. Some healthcare providers may not report fully. Some laboratories may not give all the data. So there may be some missing of cases. Some cases are missing. May fail to identify outbreaks. That's another disadvantage. But majority of public health surveillance systems are passive surveillance. Now we can go through active surveillance. Health department actively contacts healthcare providers or laboratories requesting more information about conditions or diseases to identify all possible cases. So health department not only waits for the report from the healthcare providers or laboratories, they actively contacts healthcare providers and laboratories and collects all the information available and possible. Okay, so that they can identify all possible cases. And along with that, health department detects cases from the community also. Okay, they goes to the community and collects cases actively. So all possible cases can be detected. Requires more resources than passive surveillance. Useful when it is important to identify all cases, such as a situation like pandemics or epidemics. Active surveillance is very important. Main objectives of surveillance are to provide information about new and changing trends in the health status of a population, such as morbidity, mortality, nutritional status, other indicators, and environmental hazards, health practices, and other factors that may affect health. Okay. Then to provide feedback, which may be expected to modify the health policy and the system. So surveillance can give feedback so that system and a policy can be improved and modified. Provide timely warning of public health disasters. So surveillance system can identify public health disasters so that interventions can be mobilized. Like surveillance camera, they can identify the problem at an early stage so that disasters can be suspected, and interventions can be mobilized. Resources can be mobilized. Now we will go through purposes of public health surveillance. Public health surveillance provides and interprets data. Okay, this data is used to facilitate the prevention and control of disease. That's the first one. Then this data to provide information about baseline levels of disease during times of non-outbreak. Surveillance system is active even at the time of no outbreak is there. Non-outbreak time. Okay. That surveillance information can be used as baseline levels of disease. Okay. Provide information about baseline levels of disease during times of non-outbreak. You know, some diseases are endemic, constantly present in the community. This surveillance system can give information about those endemic diseases. We can know what all diseases are there normally in the community. To assess public health status, okay, public health status of the community, to define public health priorities, surveillance system will allow us to identify what are the problems faced by the community so that we can prioritize public health programs. To evaluate health programs, so by looking at the changes in the health conditions, we can evaluate the health programs. Okay. To stimulate research, this public health surveillance can be used to generate ideas for doing more research. Surveillance is information for action. We are collecting the information so that it can be used for action. Action can be for prevention or control or collecting more information, more investigation. These are the three actions. Prevention can be, control can be, or more investigations. Determining the appropriate data collection system. Okay. There are so many data collection methods available. So we have to identify the appropriate data collection system for every conditions or every diseases. Methods of data collection available. Sometimes some diseases can be diagnosed at a specific laboratories only. So we have to be prepared for that. More number of cases, we have to open more laboratories. Availability of data. Availability of data. Okay. So we have to think about the availability of data to choose appropriate data collection systems. Timeliness of data. If recent data about the disease is available or not. Then type of health problems or conditions. So some conditions data may be available. Some diseases, some rare diseases data may not be available. So we have to start more facilities to identify the condition and collect data. Need for lab-based information. Sometimes some diseases require more laboratory-based information. Now we can go through various types of data collection systems. Okay. One is vital registration system. As already we have discussed in previous lecture, vital statistics are there. Vital statistics are recorded by one vital statistics registration system. So we can collect data from vital statistics registration system. Then next, we can collect data from Ministry of Health or WHO data. That is existing data sets available from Ministry of Health or World Health Organization. For some diseases like non-communicable diseases and cancer, there are registries having the data collected from different districts and different states. So we can collect data from existing registries, or we can collect data from survey reports. In Malaysia, there is a National Health and Morbidity Survey is conducted every 5 years, and we can collect the report. We can collect data from the report of such national level surveys. Now we will go through one concept known as Sentinel Surveillance. Okay. Sentinel Surveillance includes wide range of activities focused on monitoring key health indicators in general or in special population. Wide range of activities focused on monitoring key health indicators in general or special population. Key health events are monitored through clinics or other sites at which health events are monitored, or reporters who report specific health events. Sentinel sites. Sentinel surveillance sites are mainly hospitals and clinics. The role of sentinel surveillance sites are like this. They monitor conditions for which information is not otherwise available, monitor condition in subgroups which are more vulnerable than general population. So, I will give you an example. Sentinel surveillance is mainly used for HIV. HIV surveillance mainly focuses on the high risk group. High risk groups are those involved in commercial sex work, and those who are at a high risk like homosexuals and intravenous drug users, and those who have extramarital relationships. These are the high risk group. But there are bridge population. From these high risk group, general population will get infected. Okay, those who are having extramarital relationship can transmit the infection to their spouse, or those who are intravenous drug users can transmit the infection to their spouse and their sexual partners. So the disease can move from high risk population to general population. So sentinel surveillance system will help you to identify the increase in the disease in general population. So it is very difficult to identify HIV prevalence in general population, right? So sentinel surveillance sites will be there which focus on highly susceptible people in the general population, like pregnant women. So sentinel surveillance for HIV will look for HIV prevalence among pregnant women. If HIV prevalence among pregnant women is increasing, means it can soon attack the general population. So that's a one sentinel. Sentinel means a soldier looking for cases, or a watchdog. Sentinel means a watchdog looking for a, a threat to the general population. So where this watchdog stands? At the sentinel surveillance system, in sentinel surveillance centers. they look for the increase in HIV or some disease in the general population, apart from the high risk population. Monitor conditions in subgroups which are more vulnerable than general population. Monitor condition for which information is not otherwise available. Key concepts that determine accuracy of surveillance data. There are two concepts, reliability and validity. Okay, reliability means what? One disease is reported or one condition is reported. Okay, so we will check if it is reported only at one site or from multiple sites. Is a particular condition reported consistently by different observers? That shows reliability of the surveillance data. Validity. Does the particular condition as reported reflect the true condition as it occurs? One case of influenza got reported. We have to make sure that that case is actually a case of influenza. How we can confirm it? We have to test it to make sure that it is influenza. So that's validity. Does the particular condition as reported reflect the true condition as it occurs? Reliability means one case reported, again one case reported from another side, one case reported from another side. Repeatability means, reliability means repeatable, reported consistently by different observers. Basic epidemiological parameters of surveillance are time, place, and person. Data analysis should be done by time. Compare number of case reports received during a specific interval of time. Okay, compare number of cases for a current time period with the number reported during same interval during previous time period. So this year 10 cases are reported. Then we have to compare with last year same period. How many cases are reported? Compare number of cases for a current time period with the number reported during same interval during previous time period. Data analysis by place, where the exposure occurred, not where it is reported from. Okay, so we have to think about the exposure, from where the exposure occurred, and not where it is reported from. Allows prevention resources to be used effectively. So we can think about contact tracing. Who else may have got the exposure? Then we have to think about the isolation of cases. If a case occurs, we have to isolate the case so that disease is not spread to others. Quarantine of cases, quarantine of people, those who have got exposed but not showing symptoms will be kept in isolation for a maximum incubation period. That is known as quarantine. Use of computer and spatial mapping software. There is one system known as geographic information system. So we can map the data with the real-time map of Google Earth or Google Maps, and we can link the location with the cases. That is, geographic information system software allows for sophisticated analysis. Data analysis by person. These are the possible variables: age, gender, race or ethnicity, marital status, occupation, level of income and education, travel history is also very important. Why interpret and disseminate information? Okay, so we collected all the data collected and data analyzed in terms of time, place, and a person. Which time it occurred, which time the exposure happened, so that we can identify the other possible infections and possible cases. Place where the infection started or where the exposure occurred. Okay, that's a place distribution. We can use mapping and we can use spatial software. Person distribution, the characteristics of the person like age, gender, occupation, education, travel history, and all. So, why to interpret and disseminate information? Okay, we got all the information, then we have to disseminate to help decision makers understand the implications of information. So, decision makers can take policy decision, take prepare guidelines for control, prepare guideline for treatment, prepare guideline to reduce mortality, morbidity, all these things. Facilitate consequent implementation of public health action. Interpretation of information. We need to present information clearly. Okay, we got some information about disease, information about place, information about person, information about the disease transmission or the time of occurrence. But we need to present the information clearly. Otherwise, our information will be misinterpreted. Know your audience before conveying information. So, knowledge level of audience may vary. Okay, sometimes some microbiology specialists will come and tell about the reverse transcriptase, polymerase chain reaction, and the molecular mechanism, and how it attaches to this various enzymes like angiotensin converting enzyme and all. But the audience should be able to understand it. So you need to know your audience before conveying the information in, in a language that they can understand. These are the steps in dissemination of information. You can use visual displays to convey structure of data and analysis. Transform data mathematically to simplify distribution. How many people may get infection? 1 in 100 or 1 in 1000 or 1 in 2000, like that. You transform data mathematically so that it is simplified. Usual visual display. You can project as some diagrams, some videos, some animation, like that. Investigate influence of outliers. Okay, sometimes some outliers may be there. Okay, some elderly people are affected and it may be the cause of mortality, or you have to identify the influence of outliers and how the data changes, or how mortality is happening, how. Okay, you link with the cases. Limitations in data. These are the limitations. Under reporting of data. Sometimes data is not reported fully. Okay. Unrepresentativeness of data. Sometimes diagnostic tests may be very expensive. So only those who can afford will be testing. Others may not be getting tested. So uh, that show unrepresentativeness of data. Inconsistent case definition. If you change case definition every week, number of cases diagnosed may vary. Limitations of reporting system. Sometimes some reporting system have some limitations like under-reporting or incomplete reporting. Okay. If consistent surveillance methods are used, data will describe the trends despite underreporting. So even if underreporting is there, if surveillance methods are used, good surveillance methods are used, we can study the trends in occurrence of disease. Factors contributing to incomplete reporting. These are the factors leading to incomplete reporting. Concealment of data due to social stigma. Sometimes some countries, some states may conceal their data. So uh, some countries may hide their poverty level, unemployment level, so that government will get stigma outside. Government does not want to expose their poverty level outside. Government does not want to tell out the unemployment problem outside, or criminal tendencies or crimes in their country they hide. So that's concealment of data due to social stigma. Some diseases also show social stigma, so there is concealment of data. Lack of awareness of requirements of reporting. Sometimes doctors don't know which all diseases must be reported, which all diseases no need to be reported. Sometimes lack of awareness of health workers. Some data may not get reported. Inadequate knowledge of case definition. Okay, some if you are going through some health system in developed countries, they have they have strict protocols. If a person with a running nose, they have to go for swab, um, uh, collect swab for analysis, do cultural sensitivity, do the viral testing before starting treatment. So that's a then case definition also is very strictly defined. Case definition is there. So those with these all symptoms plus these all investigation positive will be classified as diseased. Understood? Changes in procedures used for diagnosis. There are different methods used for diagnosis. If there is no strict protocol, different doctors use different tests for diagnosing. So the uh, some diseases may not get diagnosed fully, and there will be incomplete reporting also. Variations in diagnostic skills of health workers. Some doctors or some health workers will be more skilled in identifying the disease or diagnosing the disease. Some doctors or health workers may not be that much skilled in identifying the disease. Low priority for reporting. Okay, some diseases, reporting of disease is not made mandatory. So there is low priority for reporting. I have seen many doctors, they will tell, oh, I have seen so many cases daily, 200 cases, no time for reporting. Reporting, they have to fill one sheet regarding all the patient's information and send by post to the health department. So many doctors, because of the workload, they cannot do reporting. So low priority for reporting, or it is not made mandatory, and they are not aware of the importance of reporting. If a case of cholera is reported, immediately Ministry of Health will know that one case of cholera is reported from this village. So there is some problem regarding sanitation is there. So immediate chlorination of water, immediate sanitation measures is needed, so that cholera will not be spread to others. Okay, so uh, reporting is very important to control the disease and to prevent further spread of the disease and for doing further investigation. Okay, strengths of reporting system. Okay, If a good reporting system is there, quick information is provided about the disease condition. Quick information is transferred to the Ministry of Health, and some about some diseases like cholera, yellow fever, plague, and polio. It is suddenly intimated to World Health Organization. Some outbreak like influenza or coronavirus infection, sudden information is transferred to World Health Organization. Okay. Detection of outbreak. A reporting system will help to detect outbreak quickly. Detect changes in patterns of disease. Okay, that's the second one. Detect changes in patterns of disease. Then availability of information from all jurisdiction. So reporting from all the departments, all the sectors will add to the information available to the government. It is a basis for prevention recommendation. Reporting system is a basis for prevention activity. It is a basis for control activity. Like more medicines are needed. So reporting system will alert a need for more medicines. The reporting system will alert need for more personal protective equipments. The reporting system will alert the need for more hygiene activities in the community, like that. Okay, prevention recommendation, control measures, and treatment, and personal protective measures. Now we will go through the next session. Okay, that's a health information system. Introduction to health information system. So first we identified what is surveillance. Data is collected, compiled, analyzed, interpreted, and that information is used for action. What are the action? Preventive action, control measures, or more investigation. There are three type of surveillance we discussed. Active surveillance. Active surveillance means health department goes actively to healthcare provider, actively to laboratory, actively to community to collect all the information so that they will not miss any possible cases. Passive surveillance system means they are waiting passively for the report sent by the healthcare provider, the report sent by the laboratory. They are just passively getting it. Okay. Sentinel surveillance system means please think about the HIV. There are so many transmission in high risk group. But Sentinel surveillance system is through Sentinel surveillance sites, maybe at clinics or hospitals, looking for increase in occurrence in general population. Like I told you before, the increase in occurrence of HIV among pregnant women. That shows that the HIV is increasing more in the general population, transmitted from high risk population to general population. So to identify that only Sentinel surveillance system. Then there are so many data collection systems are there. Then reporting systems are there. We should have a good reporting system, good data collection system. That is a requirement for good surveillance system. After that, okay, data collection. I told you data is stored in various ways. It is in websites, it is in Ministry of Health database, it is in uh, vital registration system or World Health Organization database. Now we will go through more about health information system. Information system is a system which provides specific information support to the decision making process at each level of an organization. Okay, is a system which provides specific information support to the decision making process at each level of an organization. So information is provided through information system. Health information system is an information processing and storing subsystem of a healthcare organization. Healthcare organization has a subsystem. It is for processing information and storing. Okay, an information processing and storing subsystem of a healthcare organization may be a single institution or a group of healthcare institutions. So, health information system should have information about a single institution or a group of institutions like healthcare network. If you are checking state health information system of Perak, means all the hospitals of Perak state will be linked to that state health information system. So all the data will be available through state health information system. If a national health information system have information about public and private healthcare institution in the country. Okay, so healthcare network. Health information system, okay, is an integrated effort to collect, process, report and use health information and knowledge. Okay, first health information system will collect the health information. Okay, then process the health information, then report and use health information and knowledge. For what purpose it is used? It is used for influencing policy making, program action and research. So health information system uses health information for influencing policy making, program action and research. Information in healthcare delivery. Okay, why information is very important in healthcare delivery? One is evidence-based policy and strategic decision making. Okay, evidence is very important. Based on the latest evidence only, policies are framed. Okay, now you think about the current coronavirus epidemic. Policies are framed based on the evidence. Oh, what is the incubation period? What are the method of transmission of virus? Okay, what are the symptoms of infection? Everything. Okay, so evidence-based policy and a strategic decision making. Then program management. You are managing a healthcare program. So information is very important for management. Monitoring the process and outcome. Monitoring the process of the program and the outcome of the program. Okay, there are two terms in postgraduate studies. We do the process evaluation and outcome evaluation. Process evaluation means how the process of disease control is going, which area it needs improvement. That is a process evaluation. Outcome evaluation means how many cases are reported, how many cases are dying. So we can improve the program so that outcome will be better. Evaluation of achievements. There are so many achievements are there. Okay, in case of coronavirus epidemic, the flattening of the curve. That is one achievement, flattening of the curve, so that we can use all the resources to control the manage the cases and to control the problem. Okay, the number of cases coming to the hospital or coming to the ICU can be minimized when we are flattening the curve. That's why we are using various strategies like social distancing to flatten the curve. Now, health management information system, these are the various objectives. Okay. First objective is strategic planning of health programs and policies. Okay. Health management information system will have lot of information, right? So that information is used for strategic planning of health programs and health policies. Okay. Then second one, this information improves disease surveillance system. So better health management information system, all the information is managed in a better way means the surveillance system is better, disease surveillance system is better. So another one, they are using health management information system is using ICD-10 for all health records. ICD-10 means International Statistical Classification of Disease 10, 10th revision. International Classification of Disease 10th revision is used. So everyone will use the similar terminology for similar disease. So health management system will be having uniformity and objectivity. Okay, so every health worker, everyone involved will be using ICD-10 for defining the diseases. Develop a national health database. Health management information system can get data from different states, different districts, and it can develop a national health database. Use of scientific evidence based on clinical or community research. So health management information system uses scientific evidence based on various clinical or community research evidence. Quality assurance or assessment of outcome of medical care. So health management information system data can be used for quality assurance of medical care or assessment of outcome of medical care, like we discussed before, program evaluation, health program evaluation, health program monitoring, process in health program or quality of health program, all can be monitored if health management information system is good. Cost control and productivity enhancement. So health management information system can be used for controlling the cost and a productivity enhancement also. So these are the various objectives of health management information system. It can be used for strategic planning. It can be used to improve disease surveillance system. It has to use ICD-10 for all health records. It has to develop a national health database. It should use scientific evidence based on research, quality assurance and assessment of outcome of medical care should be done. Cost control and productivity enhancement is also one objective of health management information system. Importance of health information system. Okay, there are so many. Okay, it produces health information system produces information needed by patients, communities, service provider, program manager, policy maker, providers of funds, global agencies and organizations. So health information system produces information, collects, compiles and publishes information. Then information used for better management, assess coverage and quality of service, okay, cost and expenditure. Okay, so it is for better management, better assess, better coverage, better quality of service, better cost management. Okay, detect and control emerging and endemic health problems. Okay, detect and control various problems, emerging or endemic health problems. Then for monitor progress towards health goals and promote equity. Okay, progress towards health goals and promote equity. That is also one importance of health information system. Okay, these are the various components of health information system. Health information system resources are there. Process. There are so many processes like health information system indicators, data sources, data management, and outcome. Outcome includes information products, dissemination, and use. Okay. Components and standards of health information system. It includes health information system resources, indicators, data sources, data management, information products, dissemination, and use. Okay, we'll go through each. Okay. Health information system resource. Okay. Resource include legislative, regulatory, and planning framework, personnel, finances, logistic support, and information and communication uh, technologies. Okay. Indicators involved in health information system. Health information system resources means there are so many planning framework, regulatory framework, legislative framework, personnel, finance, logistic, and ICT. Okay, I will tell you. It's very easy to remember. Health information system resources means there are some legal measures are there. Legislative means okay, what all data should be kept, how much important the data keeping and all. The regulatory and the planning framework means there should be a regulatory board, how the data should be kept, how the data should be monitored and used for prevention and control. Personnel means there should be staff who are trained in data management. Finances means funding should be there. Logistic support means there should be space to store the data and some facilities for storing data. ICTs means some websites should be available, some data space should be available where the data related to all health department is stored. Indicators means what all indicators will be stored, all determinants of health like social determinant, environmental determinant, socio-demographic determinants, all these will be stored in that. Health system inputs, outputs, and outcome. Okay, health system inputs means how many hospitals are there, how many health staff is there, and how much input is there in health. Outcome means how the mortality data, morbidity data. Okay, various mortality and morbidity indicators. Data sources. Okay, what all data sources are there in the health information system? Census, registration, population survey, individual record, resource records, service record, all things. Then comes data management. How the data manage, data collection, storage, quality assurance, and flow of data, processing of data, compilation of data, and analysis of data. So in Malaysia there is one institute of health research is there. They are collecting data from various health institutions like public and private institutions, and they are collecting the data, storing the data, quality assurance and flow of data, processing of data, compilation of data, analysis of data. All these are done. Information products, data transferred into information. Okay, data is converted to information. That's why whatever data is available, they will compile it, interpret it, and present it in websites like a Ministry of Health website, uh, uh, Statistics Department website, Census Department website. All these are available. Okay, to the public. Information for evidence and the knowledge to shape health action. So, if you are a doctor working in a health clinic, you can access the data about the state, about the uh, about the district's health data is available. So based on that, you can modify your health action. Dissemination and use, making information readily accessible to decision makers. That's very important. And for communities. So community also, local people or population, local ordinary people can access the data about the health problem and health system and about the various health programs, and they can modify their life according to that. Okay, so now we are finishing the health information system. First part was surveillance, all of you understood. Health information system means all the data is um, stored and used for decision making, used for program evaluation, or program uh, policy making and action. Okay.